Here at Palm Beach County Fire Rescue, one of the things we're always trying to do is find new ways to meet the needs of the community. One of our new initiatives that we're excited about is our sensory sensitivity comfort kits. These are very simple items that our personnel will use as a better way to interact with those who have autism and other types of sensory sensitivities.
A lot of this stuff is going to be, what's familiar, to those patients, those individuals that we're coming into, and to give them that comfort and that trust and that sense of security right out of the bat.
We've researched and compiled the best practice items, and we've packaged them in a very small backpack.
Everything from the trucks, from the radios, from the equipment, everything, the monitors, all that stuff that we bring into their environment is a sensory overload. And for a typical person to deal with that, it's a lot. And now you take somebody who is on the spectrum, has those heightened sensory issues and everything. It can be painful.
The comfort kits as they exist right now have a set of earmuffs, which of course is going to be used to eliminate any noise that may be distracting, confusing, or disorienting. Additionally, there are two tactile oriented items. There's a fidget spinner and a small squeezable object. Both of these items are familiar and provide something else for them to focus on. The comfort kits will also contain other safety and resource information pamphlets. For calls when communication is difficult or not possible, we also have medical communication pictures, which connects images and words associated with them. These are on the tablets and phones that we use out in the field. These will allow the crews to point to pictures to gather information on medical history or events leading up to the situation that may be helpful to know. Or it may indicate medical procedures that we're going to perform, whether it's taking a blood pressure, listening to lung sounds, starting an IV, something to point to give them an idea of what we're about to do so that they are not caught off guard. This will help us communicate with people who are nonverbal, who may have injuries or paralysis of their mouth, or for people who speak languages other than English. And this is not just for patients. These can also be used with family members or bystanders on scene. With these small objects, we can achieve the same result and outcome, but with far less invasive and traumatic experience. And this isn't just going to be used for children. These can be adults that have these same types of sensory sensitivities. So these items will allow them to focus their attention on one thing. Any extra layer of safety and calm that we can bring to that environment is going to be a benefit to everyone.